It is my pleasure to be able to introduce our guest speaker today. So our guest speaker today is Karen Fleming, who was hired as the Executive Director of the Maltby Centre in March 2020. She actually took her position just 3 days before the COVID-19 pandemic was declared. Obviously, that was a major change in the way that business was to be conducted. Since joining the Maltby, she has guided the organization through a global pandemic, led the development of a new strategic plan, and has focused on enhancing Maltby's role and relationships within the community it serves. Karen is a registered nurse by background and is an experienced senior health executive in acute care and community care. She's also the proud mother of Nicholas, who has recently graduated magna cum laude from the law program at the University of Ottawa. She's also an avid reader and loves to hike and kayak. So without further ado, our guest speaker.
Thank you, John, for that welcome, and thank you for the invitation, Paul and Elspie, for me to speak today and tell you a little bit more about the Maltby Centre. It's a pleasure to be able to speak to a 100-year-old Rotary Club who's invested in creating and sustaining healthy communities, which is just like the Maltby Centre. You might find through the presentation today that our goals for service to the community are quite aligned. As we work through the slides today, we're going to address both of these presentation objectives. And you'll notice that Maltby Centre is very big on partnerships in order to fulfill our mission of creating a healthy community. We work very closely with some of your members, like Sean Quigley at Youth Diversion, who's on the screen, and Krishna Burra from the Limestone District School Board. So we're going to describe the overall purpose, function, and connection of the Maltby Centre within the KFLA community. And we're going to have a little bit of conversation about how the pandemic has affected children and youth with autism and mental health during this last couple of years. So we're first going to start with a little bit of a high brush overview of Maltby Centre, and you can see that we are a community provider of mental health and autism services to children, youth, and families in KFLA, and we've been doing that for over 25 years now. Several years ago, we were designated by the provincial government as the lead agency for child and youth mental health in KFLA. We are a signatory partner on the Ontario Health Team for the KFLA area, and we were the previous lead for autism prior to the change in autism to a more of a fee-for-service model in KFLA. We have about 130 staff with a budget of just under $18 million. So we're not a large organization, but as community organizations go, we're a fair size. We've got 5 campuses throughout KFLA. That includes here in Kingston at Hyperion Court, at Napanee, Sydenham, Charlotte Lake, and Northbrook. Part of what helps to explain any organization is its strategic plan, and our board of directors developed a new strategic plan in the spring of last year. It is a plan that we know resonates with our clients, families, staff, and partners because they all had the opportunity to have input into it. There are numerous facets of our organization that bring this plan to life, but perhaps none more important than our clinical programs and services. On this slide, you can see the various programs and services in our clinical sphere that we offer. Crisis and brief therapy includes intake. It includes quick access to services, quick response for mental health, and walk-in for mental health. Our counseling and therapy group is for more complex needs, and we are seeing more complex needs in the community as a result of the pandemic. Intensive and groups is in-home support and groups and family capacity building groups and workshops primarily for mental health. Our early years is a combination of mental health and autism, and it focuses on our younger clients, typically 6 years of age and under. And it includes autism and our Project Impact, which is a program that the government is specifically funding us for, as well as school support. And these include in-school programs and supports for both mental health and autism. And we work very closely with Limestone District School Board and the Algonquin School Board as well. And finally, we've got our OAP core and foundational services, and that is entirely related to autism services. So that's a very high level overview of the clinical programs that we offer. These are some quick facts from our last fiscal year and our 2020-2021 fiscal year. And you can see here that we see approximately 3,500, 3,700 clients overall in our organization throughout a given year. We've got a youth advisory and a family advisory committee. And the youth advisory, we've got 14 youths who provide tremendous guidance and support, and they've created a lot of conferences in the last couple of years that are online and most recently in person. And we get about 200 youth who attend each of these conferences from different schools and school boards in the area, including from Queen's and St. Lawrence College. You can see here that our clients indicate, 94% of them indicate that they've had a positive experience at our walk-in clinics, and all of our counseling and therapy staff are part of a regulatory college, which is really important. And of course, we've got 27 student placements that we have undertaken, and that is largely with Queen's and St. Lawrence College. So here's where we may find that we've got some commonalities, and the creating healthy communities piece, the concept of a healthy community, as you know, is really rooted in public health. And it requires a really strong commitment from local government, other community organizations like Rotary, the United Way and Maltby, for example, health systems like the OHT and the hospital, right up to those provincial and national governments to drive toward the elimination of inequity in all facets of our society. And healthy communities are achieved through partnerships. And those are partnerships in things like education, housing, food, transportation, health services, social services, and the list goes on. Healthy communities are inclusive communities, and they focus on breaking down barriers to access of essential needs and services. As we live out our strategic plan and our commitment to partnerships and fostering a healthy community, this is a sample of some of our key partnerships. One partnership that is new and developing and will be added to our list next year is our relationship with the Boys and Girls Club. And I believe a number of Rotary members here were involved in the creation of the Kingston Boys and Girls Club. We're currently actively engaged in planning with their staff related to respite programming opportunities to support their clients and our clients. We also have key funding partners, and while the provincial government is clearly our biggest funder, we couldn't offer some of our programming without key partners like the RBC Foundation and the United Way. So we're very grateful for the funds that they provide to us, and it's been well in excess of $100,000 this past year, and it allows us to provide brief service free to youth between the ages of 18 and 24. And typically those youth would perhaps have difficulty accessing services in the community. We're also very fortunate to be the annual recipient of what is now known at Maltby as the Tyler Lambert Fund. And this is a new fund that started a couple of years ago. Tyler Lambert was a client of ours and a youth in our community who died of suicide. And their family has actively engaged in fundraising for Maltby Centre, and last year raised over $20,000 for Maltby. And they asked that the bulk of that money go go to provide clients the opportunity to participate in sports that they may not normally be able to afford. So things like hockey and swimming and dance. So we have used all of the money, and we still have requests coming in. So we look forward to partnering with them again this year in the development of this fund. So these key funding partners have allowed us to offer opportunities and supports to our local community during and through a very difficult pandemic. And I'm going to chat a little bit about how the COVID-19 pandemic has impacted children and youth in our community. I'm sure many of you have firsthand experience from family members related to this. We know that there has been much public debate and often very divisive commentary around the impacts of children and youth as a result of the pandemic. We know factually that the pandemic has restricted socialization. It's significantly impacted academics. We know that, as well as access to things like school nutrition programs, school-based rehab services like speech language pathology and occupational therapy that some of our autism kids would normally rely upon, and extracurricular activities that support that cognitive neuromuscular development. So things like sports, music, different clubs in the community, and camps. Schools, for us anyway, also provided that really important and needed surveillance for child abuse and neglect. And that's been drastically interrupted over the last 3 years. And of course, threaded through all of this is the pandemic really highlighted system inequitability. Recently, earlier in the year, I want to say about January, a professional publication called JAMA Pediatrics, they published a systemic review of school closures during the first wave of the pandemic. And they looked at 36 studies from 11 different countries that included just shy of 80,000 kids. So it was really a good, solid study. And it did note that about 18 to 20% of the kids scored very high for anxiety and depression symptoms. And you're going to see in the next slide that this is absolutely no different in KFLA. Well, before we get to the next slide, I do want to just show this slide. I use this slide a lot in my talks because it makes clear really the broader system inequity. And to support our mission, vision, and values throughout the pandemic, Maltby offered laptops, we offered cell phones, and we offered data sticks to our clients to ensure that they had the equipment and tools that they needed to participate in the services that Maltby offered, and to virtually interact with their peers, as well as continue to participate in school virtually. We also made like many organizations, we made our Wi-Fi accessible to everybody in the parking lot, and so at all of our parking lots. So they were, folks were able to come and freely use our Wi-Fi. A large portion of our clients don't have technology in the household. And so that created a real barrier, not only to learning, but to continuing to access services at Maltby Centre. And if they did have technology in the home, it was sharing a cell phone with a parent, which then doesn't allow for confidentiality of services. So in the end, then, what does this all mean? And we'll flip to the next slide, because here's the meat of it all. So this is our data from our mental health walk-in clinic, and you can see from January of 2018 up until January, February of this year, you can see how much the increase has been in volume in our walk-in clinic. Especially you can see from the pre-pandemic time to where we are now. In our walk-in, we see a mix of clients. Some clients only need one visit, and other clients need to transition to counseling and therapy, which is a longer term, kids that need longer term service requirements. And unlike pre-pandemic intake of children and youth to Maltby, we are seeing that now that the mental health symptoms and presentation is moderate to severe. And so this is really a drastic change in community need during the pandemic. And children's mental health systems locally in Kingston and provincially across Ontario, and I guess nationally, we're really already stretched to be able to provide and meet service need before the pandemic. And it's become even more of an issue as a result of the pandemic. And so wait lists are very, very high across the province. This is a graph shows from 2018 right through to 2022. I'm trying to see what color that is on the screen. It looks like purple. The short little purple line is this year, and you can see the significant increase per month. We have 250 to 350 kids that are referred monthly to counseling and therapy, and that really speaks to the need in the community. As a result of the effects of the pandemic, we've also seen a drastic rise in eating disorders. Not only anxiety and depression, but eating disorders has significantly risen. And Sean will tell you that addictions has also significantly risen over the course of the, I'm not going to steal his thunder on addictions because he can talk a lot better than I can about addictions, but it has certainly risen. And local and provincial leadership is really urgently required to build capacity to address the concerns, and particularly the concerns related to kids with disabilities or who come from lower income families, who are racialized or marginalized, like LGBTQ2S+, the Indigenous, Métis, and the Inuit. So we're working really hard with all of our partners to ensure that we're trying to eliminate our wait lists by the end of August. That's our goal. We changed the way that we are managing client flow in our organization in order to really reduce those wait lists locally. Now I'm going to get into some recommendations. I have had the privilege of meeting with Mayor Patterson on a few occasions, with our local provincial candidates as well, and with members of parliament and ministers in the federal cabinet to talk about mental health needs of our children and youth as we start to emerge from the pandemic. And in the next slide, I'm going to share with you what I've shared with each of those political groups. So here you can see I've separated this out into a long-term child, youth, and family-focused recovery strategy and investments to improve access. So if we look at the long-term recovery strategy, I have suggested that we start incorporating child impact assessments into government policy decision-making overall, but specifically as it relates to autism and mental health. We need to improve data outcome monitoring of investments in both mental health and autism, but we need to disaggregate that data to really track the inequities and ensure that the people affected are involved in the design of a new system. And we need a strategy provincially and nationally to reduce wait lists for both child and youth mental health and autism. So what do we need as far as investments? We need to expand the range of mental health and addiction services for children and youth with special needs, including autism, fetal alcohol syndrome, and medically complex children. And we need to augment crisis support in the community to appropriately care for children, youth, and families to avoid emergency department visits. And I can tell you, as a vice president in an acute care hospital previously, the emergency department is not the place for children, especially children with mental health issues. And we also need to improve our health human resources planning for child and youth mental health services in the community. So a lot of us have lost staff. There has been the great resignation across all companies, organizations, and sectors, and that includes our sector as well, both provincially, locally, provincially, and nationally. Okay, and the next slide is just to thank you. Thank you for the invitation to speak with you. Thank you for allowing me to share our story and to share the story of the children in our community. Thank you.